Today on the podcast, we are talking about navigating hookup culture, the single life. What kind of STIs are out there? How to avoid them? What are the best safe sex practices for all types of hooking up? Let's get into it. I'm Sarah King, and I have a lot of questions. What exactly happens when you orgasm physically? What can we learn from our poop? You gotta get that protein. Get that protein. Ladies, you need the protein. Do you think it's been exaggerated? If I have sex the night before my pap smear, can it mess up my results? In this show, I get to ask all these questions to WakeMed doctors who happen to know everything about everything. Sarah Has Questions is a production of Capital Broadcasting Company and Mix 101.5. It's presented by WakeMed. First of all, we're talking to Dr. Jenna Beckham. She is a all-star here on Sarah Has Questions. Thanks for coming.
Thank you. So happy to be back.
Yeah, and you're a gynecologist at with WakeMed. Just to let everyone know what you do. So yeah, we're talking about hookup culture. We thought this would be an interesting topic because from the time when I was, single and swinging, things have changed. I think that's what the word on the street is.
I think so, yeah.
So in your practice, would you agree with that? Would you say that people are having more casual sex than they did, say, 20 years ago?
Well, probably than 20 years ago, although it's one of those things that's not really easy to track with sort of data, right? And as a doctor, I like to give answers and sort of information that's, is evidence-based and data.
Scientific. Which is what we want from our doctors.
Good. Exactly, yes. But, as you can imagine, a lot of this is kind of self-report, surveys.
Right.
So, it's you got to take it with a grain of salt, what you can get. I will say, interestingly, a lot of the sort of more recent data, and again, a lot of it is more for kind of adolescents or younger adults. So the CDC does a pretty good job at keeping track of that sort of sexual behaviors for adolescents, young adults. There seems to be actually a little bit of a decline now in the last probably 3 to 5 years.
What's the top range for a young adult?
24.
Got it.
So they're the CDC's data that they look at are for age 15 to 24.
Gotcha. Okay.
Yeah.
So there's a decline.
A decline. Yeah.
Huh.
Yeah. I mean, small decline. And the things they look at are sort of, have you ever been sexually active? That has a slight
What's
decline.
their definition of sex?
Correct. Right. So it's sort of, it's a fairly broad sex, right? Any kind of and maybe we'll talk a little bit more
First,
about
second,
that,
third.
right?
We can go in terms of
bases
also.
Right? And then sort of I think one of the other questions they ask is, have you had more than 4 sexual partners? So again, kind of that, maybe more casual sex. So over the 20 years, I think if you look at a lot of those graphs, you saw an increase, but then I think we've started to see in more recent years a little bit of a decrease, at least in that age range.
Why do you think that is?
I think, everyone has a lot of theories. I think certainly COVID, right? Of course, but it seems to persist even beyond COVID. Now,
interesting.
I don't have children. I have a
9-year-old, and I haven't bridged that yet.
I have young patients. My sense is, right, I think that there's a lot more maybe sort of interacting over the internet, right? Less in person.
Phone sex and cyber sex?
Yeah, and just in general, sort of their social interactions, I think.
Well, I will say.
And that's true for my age range, adults, kind of all people.
And I will say for my 9-year-old, not that in the terms of sex, but in terms of socializing, he is much more online for it.
Right. So I think a little bit of that has maybe just changed sort of the way that, young people, all people kind of interact. We're just not as sort of in-person socially connected and interactive. And so I think that's one theory that people have about maybe sort of this shift in sort of sexual behaviors.
That's interesting.
But again, not really proven in data.
Okay. So I will say that because I have friends of all ages, and the younger ones are into much more creative ways of having sex, and they're not afraid to have multiple partners or have open relationships. Do you find that to be true in your practice, that people are experimenting more in different ways?
Yeah, I think in a little bit of a way we're having maybe sort of a second wave sexual revolution.
Yeah,
right?
I would agree with that.
I think that, people are feeling more empowered about their bodies and to find pleasure and to explore in certain ways. I think Again, all that is important within the realm of safety, and practicing that safely.
Of course, yeah.
I think, with the proper precautions and being safe, then, yeah, I think there are people who are a little bit more comfortable sort of talking about it. Again, not to belabor the internet piece, but I think we have a lot more information, ideas maybe available at our fingertips than perhaps people
it's not
did 20 years ago.
belaboring it. It's actuality.
Right.
Like you can look stuff up,
Exactly, yeah.
Yeah, and with the world of AI, though, that could get sticky.
Well, yeah.
And
AI
sticky might have been a bad word to use.
Yeah, a little on the nose.
Yeah. All right. So, what are the most common questions people are coming to you about sex? What are you hearing?
Well, yes. There's a lot of talk about sort of sexual pleasure, and I think patients asking about is this normal, right? Like I don't, and even more of the pleasure, sort of the sexual interest, sexual drive. Sometimes patients are having decreases in that,
right?
That's one thing, and then just wanting to be safe in their sexual practices. Again, patients and individuals who are engaging in sexual activity with, multiple partners and open relationships. Even patients who maybe are a little bit older. I have some who maybe have been in a long-term monogamous relationship that ends. They're kind of back on the dating scene.
I think about
right?
that all the time. Not that I want to divorce my husband, but you never know. Life throws things at you. And I'm like, God, if I had to enter the dating scene,
right.
I'd be terrified.
No kidding, right?
Yeah.
Is that real different than 20 years ago, right?
100%.
So there's a lot of that sort of, what do I need to be tested for? What things should I do, right? So, I think patients are asking good questions about just ways to keep themselves safe, both in terms of preventing sexually transmitted infections, and as well as if they're not desiring a pregnancy, which often if it's a more casual,
you don't want to do that.
It's not for the purpose of achieving a pregnancy, and so thinking about that as well.
Do you find that people are more open in speaking about sex now than they used to be?
I do, especially my younger patients.
Yeah.
Sometimes they use words that I even have to say, can you tell me what that means?
Oh, really? Can you give an example?
Well, they use a lot of acronyms and things. So, right. One thing I teach medical students and residents, and I say when I was a medical student, we were taught to ask in a sexual history, do you have sex with men, women, or both? And that was sort of thought to be the very inclusive way of kind of asking about sexual behaviors.
Oh, okay.
I would say even now, I think that that's fairly narrow and kind of has this binary approach to sort of partners. So I often ask my patients, one, are you sexually active? And if they are not, then I follow that up with, is that by choice or, right? Because some people maybe want to be, right?
Yes.
And some are not in that point in their life, or some people are asexual and have zero interest in that. Or if they are, then I say, tell me about your sexual partners and your sexual behaviors.
Yeah, which is a much more open question.
Right. So then I kind of let them use, and some people may say need a little prompting for what does that mean.
Yeah.
But, some of my younger patients will, one term, for example, they say, I don't, or I do have PIV sex, which
PIV?
Penis and vagina sex.
You gotta be kidding
Not kidding.
me. PIV?
PIV, yeah.
Wow.
Right. So for, particularly for my patients who are assigned female at birth, right, it's particularly relevant if we're talking about their risk of pregnancy.
Sure.
Could they get pregnant or not, right? And then, are telling me about their multiple relationships, being poly, right, things like that. So
yeah, and I feel like that's more common. Polyamory is a lot more, which is multiple partners.
Right. Yeah.
Yeah, and I mean, from my experience in this world, if you're in a marriage and you go into an open marriage, tends to not work. But I think in the younger generations, perhaps it is working.
Yeah, I've definitely, seen, I have patients who are in very successful polyamorous, either open relationships or even some who, have just two dedicated partners, and the three of them live together, function very well. I've had a patient, I had surgery, and, both of their partners were there for pre-op appointments and on the day of surgery and equally involved in the care. And so, it does work for certain people. Now, there's
it's all about consenting adults.
Exactly.
If you are in this, it's consensually, I don't care what you do. That's my personal opinion.
Right. Yes. Yeah. Consent is
it has
really
to be
important.
Consensual.
Perfect.
Absolutely.
Yeah. And definitely something I talk to my younger patients about a lot, especially, I have younger patients who their parents are maybe bringing them in. They're starting to explore sexual activity, wanting to get them on birth control, right? And that's one thing that's really important to make sure that they understand what consent means, how to ask for it, how to ensure it is discussed.
Right. And as a mother of a son, I'm always like, when someone says no and stop touching me, stop. He thinks right now it's for fighting and purposes like that.
Right.
He doesn't really realize this narrative is going to move into
Right.
other
Well, it's a good way
territories.
to introduce the concept, right?
Yes, exactly.
Similar,
it's like,
right?
once you tickle him right now, then you stop. Yeah.
Yeah. No means no, right?
No means no.
Yeah.
If no matter how excited you are.
Right.
So you do education. And I don't know how much you know about this, but sexual education in schools. Like, how does sexual education look different than it does today?
Oof. Well, let's see. That's I would maybe a little bit of a loaded question.
Is it? Not intentionally.
Not intentionally. No, not for I think it gets a lot. Currently, it's getting a lot of attention.
Well,
right nationally, right? It varies by state, right? It's one of those things that's actually regulated, at least in public schools, by the state government. They actually direct sort of what can and cannot be included. In our state, there's currently some proposed even more restrictive changes of what can and cannot be discussed, certain age limits, grade limits, and even, some proposals that they want parental consent for certain things to be discussed in schools.
Well, parental consent, I suppose, is important. For me, I just don't understand the idea of not telling your kid everything, because the world's going to show you if you don't tell them to begin with.
Right. And I think if you approach it, like we mentioned, it's scientific evidence, right? It is a factual thing that exists that young people are going to explore. And I think there's a concern that, if we teach sex education, it's promoting sexual promiscuity or sexual activity, which it's not, Do
you remember sitting in sex ed? Do you remember how awkward that was?
Oh, right, yeah.
You weren't going, I'm
not
the thing
to make you go like, right? I had never thought about that until now.
It was more like, my mouth is wide open, like, oh my God.
And do I really want my 6th grade teacher to be the one I'm talking to about this?
They need to go back and experience middle school is what they need to do.
But I do think there is a hopefully in elementary schools, like when you and I were getting sex ed, it was very much like, here's the movie to watch and here are your pamphlets, right? Like, ask us any questions.
Yes,
right?
Exactly.
I do think when it's done really well, that consent piece is really important. Of making sure that that's really discussed in schools.
Absolutely.
And then again, in the schools and the school systems that do it really well, I think being more inclusive, both in terms of what is sex,
what
right? It's not just
sex,
not just the PIV sex, right?
We are so cool now.
Yeah.
Oh my God.
All different types of sex and body parts you can use, right? Like risks of pregnancy, risk of STIs, all that is really makes for comprehensive sexual education.
Absolutely.
Doesn't always exist, but
I remember when I was in middle school, the condom on the cucumber had just started happening. It was controversial.
Yes.
We did it.
Yes.
We did it. And I was like, this is dirty. So what important advances in medicine has happened regarding this like casual sex, the openness of sexual behavior now?
Yeah, I think a few things sort of, again, that in open, more casual sexual behaviors, multiple partners, right? We do know there are some risks involved. And again, that's why it's important to take precautions. So one of those are perhaps increased risks of sexually transmitted infections. But that's probably the area of, sort of medicine that's more advanced in terms of there are some medications that individuals can take actually preventatively, mostly for HIV. So PrEP, which is,
but isn't that only for men?
Well, not really. So that's what it's thought of. And actually, as OBGYNs, we are not very good at sort of screening and talking to our patients about it. It was originally really intended for men who have sex with men.
That's what it says in the commercial. It says intended for males assigned at birth.
Exactly. Yeah. Men assigned at birth, sex assigned at birth, male who have sexual interactions with other assigned male at birth partners. But actually, it can be used for other individuals, and it's sort of a risk assessment depending on your sexual risk behaviors, who your sexual partners are, your sexual anatomy. But it's even though that's sort of the target audience, it can be used otherwise.
Okay.
There is DoxyPrep, which is a medication, doxycycline, which is a treatment for chlamydia. That's still pretty early in sort of its study, so it's not yet fully FDA approved.
And that would be a
preventative measure.
Gotcha.
Right? Yeah.
Okay.
There are at-home testing for sexually transmitted infections.
That was one of my questions. You're jumping ahead.
Oh, sorry. Now, those are intended really more for sort of screening. I would tell my patients, if you have symptoms or you had a known exposure, you're really concerned, see a healthcare provider because you want that test result quickly and you want to be able to access your treatment quickly.
Yeah.
Right. But if you're just trying to do it to kind of keep yourself safe and protected, those do exist for at-home testing.
Well, that leads me up into my next series of questions, which is STIs, which used to be known as STDs.
Correct.
Now they're sexually transmitted infections.
Yes.
Which I really don't, it feels like you're splitting hairs.
Yeah, it's a little bit of a connotation word, right? Like the term disease implies this condition maybe that someone's going to live with for a long period of time. And most of them are truly acute infections that are treatable.
Okay, good.
Can be gotten, get rid of. So I think a little bit of that. It's a little more medically accurate and I think an improved sort of, impression.
I'm trying to get rid of the word hysterectomy because I hate that word.
Right. From hysteria.
Exactly.
Yes.
Yeah. Get rid of that one.
Yeah.
So are STIs more prevalent now, you find?
So again, interestingly, and a lot of our data is more amongst young
younger
patients,
people,
that younger population. And there's some variation. Some of it varies geographically. So certainly if you look at a map of the United States in different states,
there are hot zones.
Hot zones, yeah. Even amongst specific counties. But kind of nationally, we've seen a decline in gonorrhea overall.
Okay.
Chlamydia is kind of staying level, maybe slight decreases, but no real drastic changes.
Okay.
One sexually transmitted infection we've seen continually rise is syphilis.
I have heard that.
Yeah.
I feel like that's like medieval.
Right? Yeah, it's one of those things I think we don't talk about a lot. We don't think of, right, when a lot of people think of STIs or formerly known as STDs, right? We think of gonorrhea and chlamydia.
Yes.
Kind of
you
those
don't hear
are the
about
more
syphilis.
common. You hear about syphilis. Yeah, but especially even in North Carolina, our syphilis rates in general in adults and then congenital syphilis. So
passing it on to your children,
from pregnant individuals into the infant or the fetus is on the rise. So
is that one treatable?
It is treatable.
Oh, good.
It's a little more involved in the treatment. So like chlamydia, you can take an oral antibiotic. Gonorrhea is generally one injection. Syphilis, it depends on kind of the type of syphilis, the phase you're in, but it generally involves multiple injections of a medication.
Oh, wow.
And so I think sometimes that can be a problem of, patients kind of completing the course of treatment, follow-up. A lot of times it can initially be fairly asymptomatic.
Oh, interesting.
Meaning, you might have it and not
just spreading it everywhere.
Right? Yeah. And then again, I think there's that education and awareness piece of it.
Well, one that I learned about, I think we all learned about, is HPV.
Yes.
That's like new. That wasn't around when I was younger.
Yes. And that one is, it's interesting that it kind of technically falls under the STI broad umbrella, but isn't really the same in that way that it's not always like an acute infection that gets treated, right? So we can live with HPV for our whole lives. Really, I tell my patients, most individuals who have ever been sexually active have been exposed to HPV.
And it's just so does that mean you're carrying it?
Often, yeah, you're carrying it. We don't usually, especially assigned female at birth individuals, have symptoms of it. The way we see it is in pap smear abnormalities. And so that's how we kind of detect it earlier or detect it, more so in ourselves. And a lot of my patients then, when they have it, they say like, I've been in a monogamous relationship, married for 25 years.
Is my husband stepping out,
me? Right? Yeah. Or is my husband going to get it from him? Is he cheating on me? And it's a really hard thing for patients to conceptually understand that maybe you've had normal pap smears for 15 years and now it's become abnormal.
I've heard the same thing with genital warts.
Right. Yeah, which also come from HPV.
Yeah. Oh, is that right?
It's an HPV. There are many, many strains of HPV, but it's generally a different strain of HPV that causes genital warts.
Okay, so now I know making out is a term that means different to a lot of people. Let's just say it's like everything but penetration, okay? Can you get an STD from that?
Okay, so just like mouth to mouth, assuming, right? Yeah, like oral to oral contact. Yeah. Technically, yes. There are mucosal surfaces, so the kind of the inside of the mouth, the lips have what we consider a mucosal surface of the body.
Okay,
and those, particularly if you have like a cut or a sore, that can be transmitted. Now it's very rare. Probably the most common you would think about is like an oral herpes sore, like a cold sore. But even you can get gonorrhea, like oral pharyngeal gonorrhea, oral pharyngeal syphilis. Chlamydia is pretty rare. HIV is pretty rare. And generally those oral infections are more from oral genital or oral anal contact.
That makes sense, yeah.
Right. Yeah.
Interesting. How often do you recommend people who are sexually active? I mean, hey, this sounds like even if you're with a monogamous monogamous partner, how often should you get tested for STIs?
So there's not a kind of easy way to say this frequency, because the testing frequency varies depending on multiple things. Different for different of the infections, different depending on age. Again, because we mentioned some of the younger patients have higher rates of STIs. Different depending on your sexual behavior. So your genitalia and anatomy, your partner's genitalia and anatomy, if you have multiple partners, if you engage in transactional sex, right? So there's all kinds of it's a risk stratification screening. And
transactional sex is having sex for money.
Sex for money, yeah.
Okay.
Yeah. So, or for other things, right? There are people who have sex for maybe not money, but for other
croissants.
Yeah, croissants. Donuts, yeah.
Breakfast.
But, yeah. The CDC has really good guidelines where you can kind of, take each patient individually. If you're sort of like, oh, I don't know, I think like once a year is a good kind of just basic recommendation, particularly if you aren't in a long-term monogamous relationship.
Right.
I think if you are and you have no concerns, all my patients, I ask it for any patient. I offer it at any annual visit. And, I have some patients who have been in a monogamous relationship for decades and they still elect to get tested every year.
Oh, interesting.
It's perfectly reasonable. It's their choice.
Yeah.
But also if they said, nah, I'm good, I don't really push it. If they have multiple sexual partners, have other risk factors, again, it's their choice. But in those patients, I would more strongly recommend it.
Have safe sex practices changed in the 30 years or in the past 30 years? Not that you've been practicing for 30 years.
Right.
Yeah. It's only been, 5?
That's right. Yes, I think in the sense of some of the things we talked about, some of the like medication prevention, they're also, not that these are all new, but I think a little bit more readily available, maybe some of the barrier methods, right? So again, you mentioned our elementary school, middle school sex education is sort of the standard. We now refer to as an external condom, right? A condom on the cucumber, right? That goes on the penis.
Yeah.
But there are other barrier protection sort of tools or devices that are available. There are internal condoms. So actually you can put it inside the vagina.
Okay.
And then there are what most people kind of refer to as dental dams or oral condoms, right? That are
never actually seen one of those.
Yeah. There are specific dental dams, or, you're just like, well, I didn't have time to get that. It doesn't work quite as well. You can use even like Saran wrap or another barrier.
Oh.
Not really medically recommended or studied, but technically,
have you heard of someone doing that?
I have.
Wow.
Yes, I have.
Wow, that is being safe.
That is being very safe. Yeah, I mean, get the dental jam is probably a little better, and then make them like flavored or things, right? So
interesting.
It can make it a little, maybe feel a little more interesting than the Saran wrap. Certainly,
this may sound like an ignorant question, but it is something I'm curious about. Is lesbian sex probably the safest kind of sex?
Interesting. Is in the safest in the realm of
like catching things.
Yeah, right. So probably, yeah, right. Like
you'd have to have a cut. In your mouth.
You'd have to have a cut, right? You could, oral to genital, you could certainly get an infection. I mean, there are sexual behaviors where there's genital to genital contact or using certain toys, right? So you can still transmit sexually transmitted infections and even HPV. So there, have been reports of, individual patients who have reported never having, good thing we talked about PIV sex, right?
Yes.
PIV,
penis
and vagina sex, right? In their life, who've only ever had sexual contact with another assigned female at birth individual, but still have positive HPV tests, have had abnormal pap smears. So those patients still, need their cervical cancer screening, can still get sexually transmitted infections, but, sort of anatomically, biologically, that risk is certainly lower.
Okay. What was I going to say? So what are all the things you can get with HPV? I know we're not doing a sexually transmitted illness episode, but just quickly.
Yeah. So genital warts, you can get cervical abnormalities, so abnormal pap smears, and that's a precursor to cervical cancer.
Oh, scary.
So that's a really,
Very
the
scary.
bad thing. And then actually anal lesions, so anal warts and even anal cancer, and then oral cancer as well.
Gotcha. Interesting. What should you know about somebody in their sexual history or current health status before you decide to stop having safe sex?
Right. So assuming you're going to stop using any kind of barrier protection, right? So you would definitely want to know that they have recently been tested for all sexually transmitted infections. And even still recently, sometimes some of them, like HIV particularly, and even early syphilis, doesn't show up in that immediate test. So say you had an encounter, a couple of days ago, and now you have this conversation with your partner, and they're like, well, let's go get tested tomorrow. Even if they're negative, you would want to get retested again, probably within another month.
That's my question.
Yeah, just to make sure, right, if you're going to be absolutely safe, or wait until it's, a little time has passed since you've had any other sexual partners.
Okay.
And then, ideally you would want to make sure that they're not having unprotected sex with other partners, because then that risk
the trust has
exists,
to be there,
right? The trust has to be there. And then also if you're, if there is a possibility of pregnancy between these two people having intercourse, and that's not desired.
I don't think that gets talked about enough.
Right. You'd want to make sure that there's a plan for protection against pregnancy with some other type of birth control if you're not using barrier contraception or a barrier protection method.
Got it. All right, now we're going to, those are all my questions. Good job.
Oh, thank you.
You made it.
Excellent.
Now we're going to go to listeners' questions.
Oh, good. These are always good.
They're so good.
Yeah, I love these.
All right.
These stump me often. I'm like, I don't know. I'm going to have to look into that. I'll get back to you.
Okay. Are there any pre-intercourse or post-intercourse hygiene recommendations?
Oh, okay.
And I like that they said it so scientifically.
Yes, very. I know. Good question. I'm trying to think of how I can phrase it. Let's go to post-intercourse. So not technically, right? And generally, we don't recommend like douching, which I think our grandmothers
nobody
did.
does that anymore,
Yeah.
I hope.
Every now and then I saw that, they still sell the summer's eve, I think, at some of the pharmacies. And I have some patients who I have to really, but I think that's an old,
it's going out of fashion.
Right? So we don't recommend that. There are some individuals who have increased risk or have had urinary tract infections after intercourse.
Oh, yeah. Those are the worst.
Right. Which is, yes, terrible. So for those patients, it is recommended at least to, urinate after intercourse. But otherwise, there's not really any specific hygiene that's recommended. No kind of like washing, cleansing is going to decrease any risk of, right, like a sexually transmitted infection. If you've already had the contact, that risk already exists.
Gotcha. I wish that they would change that in TV shows, where everybody's just sitting there like, oh, that was great. And they like seem to sit there for 15 minutes when the truth of the matter is you need to get up, go pee, and then you come back.
And then you can do your cuddling,
yeah,
right?
Exactly.
Yes.
Exactly.
Yeah.
All right. So what about pre-intercourse?
So pre-intercourse, not as much for like penis and vagina sex, right?
PIV.
No PIV. But for people who are having anal intercourse or any kind of anal contact. Now, again, some of these are not necessarily sort of scientifically recommended, but there are some individuals who feel like, a particular type of cleaning out that area. So using like even enemas can be helpful. If there, is hair in the area, sort of shaving, although that's controversial because shaving can then cause nicks in the skin, right? Which could increase a sore.
Your risk.
So again, not a specific recommendation, but something people may consider doing, when using that part of their body.
Okay. Speaking of butts. This person says, I've been hearing that, quote, tossing salad is having a renaissance.
Oh.
Ooh. How hygienic is it? And is there a hygienic way to do it?
Well,
and first of all, for those who don't know, please define what tossing salad means.
And I'll just say, I asked Sarah before we started this, I was like, is there anything I can't say on the radio?
You just can't cuss.
Just clarify, no cuss words. The scientific medical term is analingus, right? So cunnilingus, right, is
the lady bits.
The lady bits, right? So this is oral to anal contact.
Got it.
Or another sort of common word that people may use is rimming.
Rimming.
Right, yeah.
Rim job.
Rim job, yep. So, is there a hygienic way to do it? It comes with some, some risks, certainly, right? We know there are
I can't imagine doing it. Is that wrong? I know.
I mean, I have to say it's not for me. But again, right,
but
you said.
If it floats your boat.
Right, whatever
go
works
down
as
the
long
river,
as, right, you got your checklist and everybody's happy and in agreement, then you do you,
judgment.
Right? Exactly. There are bacteria that are in the anal area, right? So there is risk of that, even if it's not a sexually transmitted infection coming into contact with that.
Yeah.
I do think that is one that really I would encourage patients and individuals to use like a dental dam for, right? If you're going to do it, just really try to protect yourself. If not, that's your choice.
What
Again,
if you
make
did
sure,
Listerine at the end?
That might make you feel better. I'm not sure.
You don't think it's
I don't think it's going to really do anything.
Okay,
Yeah.
Good to know. All right. Good job. All right. What sexual health guidance do you give to your friends with teenage kids?
Yes, I do have a lot of that, and several of whom have their teenage children have my cell phone number, and they say,
"Oh, good.
Can they text you with questions?" And I ask them the same thing I asked you at the beginning of the show: is there anything off limits or anything I can't?
I love that
them, right?
though. That's great.
I want to know. I want to give them advice, but also I'm not their parent, right?
Yeah.
So I want that.
What are your
consent.
limitations?
Yes. So I talk to both my friends with their teenage kids and then also teenagers. And I think many things, but the most important are consent, right? Like I just think that you just can't express that enough. And that was not something that was taught to me or, I think when we were young, which is just so important to make sure they understand, right?
It explains a lot about what happens because it's been so taboo.
Correct, right? And so making sure they understand that they are in charge of their body. They are the only person who has say over that.
And not to worry about hurting someone's
feelings. Getting teased, made fun of, right?
Yeah.
Like that may happen, but regardless, you have to be comfortable and only do things that you agree to and feel comfortable. Never feel pressured into it.
Exactly.
The risk of sexually transmitted infections, making sure they understand that exists, how to prevent them, using barrier methods of protection if they're engaging in activities that can lead to sexually transmitted infections, and making sure they understand that not only is it an infection, but that it can have impact on them in their future life. So I think sometimes people think, oh yeah, chlamydia, we don't want our kids or we don't want people to have chlamydia, but you can take an antibiotic, no big deal. But actually it impacts your future health, particularly future reproductive health, and can increase your risk for infertility.
Oh, wow.
Right. So sexually transmitted infections like gonorrhea and chlamydia can cause infections that go, ascending infections up into the uterus and the fallopian tubes and can cause damage and scarring to the fallopian tubes.
Yes. That's why you said earlier that you want to find out you have the infection and deal with it immediately.
Right. Exactly. So you want to know earlier so that it doesn't get to that point. So also, right, to say, hey, if you're concerned about it, don't be embarrassed.
Just
even
deal
if
with
you can't
it.
talk to your parents about it, you can text me, right? Like we'll figure this out. You need to get seen and get treated so that you're not letting something kind of linger without getting that, evaluation. And then certainly if you're engaging in sexual behavior that could get you pregnant, and you don't want you to be pregnant, which most of my friends with their teenage aren't trying. Every now and then, but in general are not. So making sure they understand their options for birth control, how to access it, how to use it. Things like that.
Well, great. Well, that's all my questions.
Oh, great. Those were all very, very good questions. I don't think nothing that stumped me too much.
Okay.
Today.
No, you did great. All right. Well, thank you for your time as always.
Yes, you're
Dr.
welcome.
Beckham.
Thanks for having me.
Of course. Dr. Beckham is the best. I feel like I could talk to her about anything. I am jealous of her patience because she's a great doctor. You can make an appointment with Dr. Jenna Beckham at wakemed.org. The listener questions today were awesome and quite the doozy. If you have a question for a future episode, please let us know. Get in touch at WRALFM.com/Sarah Has Questions. Thanks for listening. Stay safe out there. See you next time.